Please welcome Zayna Khayat.
We're going into the 1980s here. We're going to talk about running 2026 healthcare on 1984 infrastructure. I just need to pump up my Reeboks. Just one sec. Okay. These are actual Reebok pumps. The kids don't know what I'm talking about. All right. What do all these pictures have in common? In 1984, they were perfectly reasonable systems. Okay, all of them. Actually, one of them literally is still a reasonable system in Canadian healthcare. I believe we're the only industry left that's using the fax machine. And it is the only way your care providers are allowed to share information about you with each other is through transmission through this technology. But something else happened in 1984. We've heard allusion to it, which is that's the year the Canada Health Act was enshrined. That was the birth of Medicare in Canada, which said that we will have universally available health care for medically necessary services, that you don't have to pay with your credit card, it's available. 20 years later, some of you might remember the CBC did a TV show that they based off a show that had been done in the UK the year earlier to figure out who is the greatest Canadian of all time. And there were some pretty good candidates. You can see they made the top 10. Politicians, athletes, David Suzuki, I think he just turned 90. He looks like he's 70 yesterday. And in this kind of like round robin tournament across Canada through this TV show, we all voted for Tommy Douglas, who we've heard about, the kind of father of Medicare, right? Not an athlete, not a politician. Universal health care, our Medicare system, is like one of the only values that unite all Canadians. It did 20 years ago and it still does today. So what was Medicare? What does it mean? Think of it like a social contract. The social contract in 1984 was you and I are going to pay taxes, and wow, do we pay a lot of taxes. And in exchange, in the event that we have a medically necessary situation, protection will be available. That we'll have it available universally when we need it. Now, in 1984, what was imagined for that protection was kind of like getting car insurance. You don't expect to use or file a claim all the time when you buy an insurance program. So maybe you might have had a baby and needed to go to the hospital. Maybe there was an accident. Maybe you needed to get your gallbladder out, or the rare time someone might get cancer. That was kind of the context of when this social contract was developed. And as we've heard over and over, that social contract is fundamentally broken. As our tax base has gone up, we've been able to fund healthcare. That's kind of the supply. That money mostly pays for humans who do the work and some of the buildings, the capital, the medicines. And demand has been going up exponentially. We've been growing our population since 1984 quite a bit, sometimes double digits in a given year. We've been staying alive a lot longer and accumulating a lot more complexity, getting sicker, getting fatter, all those things. Back in 1984, there was even more supply than there was demand for healthcare, and all the infrastructure was based on that time when we had a relatively young, healthy, and small population. And nothing like that is the same now. And as we've heard, it's only getting worse. So we have 6.5 million Canadians who do not have access to primary care, to a family health care team. Imagine if you're a teenager who needed to go to high school with all the taxes you pay, you were told, sorry, they can't go. We got to wait. We don't have enough teachers. We don't have enough schools. We don't have enough buildings. This is what Canadians have been tolerating and accepting to date. And so what do we do about it? We are running 2026 healthcare on a 1984 infrastructure. Me showing up at Rotman in this outfit, something seems really off, right? So let's get at why. There are many reasons. We've heard a lot of them today. I'm going to kind of narrow in on the three, what I think are the highest impact lever points that could maybe kind of be the lock and the key. First one is how healthcare is delivered or is designed. So I kind of use the metaphor of this mismatch of, you know, repair shops. It's designed to respond or do what we call sick care instead of health. And so if you only needed to do repair shop, then as people get sicker and sicker, you would then just be building more mechanics, training more schools to make those mechanics, and creating more of these shops. And that's kind of what we've done. The next is how it's delivered. We've heard about all of this fragmentation. You know, we've been designing or proposing ways to redesign how healthcare is delivered for decades. There's something different now that wasn't available for decades, and that's AI. And I firmly believe we've got this kind of once in a century tool to be this like capacity expansion technology that can allow us to make up for massive, massive technical debt, all the things Ryan talked about, that you can't get your data, it's not interoperable. We can kind of leapfrog that as Canada in a way we couldn't do before. So I think a big opportunity there. And then the last kind of lever is around how healthcare is paid for. We are the only country in the world where it is illegal to access medically necessary care outside of one channel, which is the publicly funded system, the only country in the world. And so there is no choice, no alternatives, no escape valve, and there's no basis for competition on the things that Canadians value the most, which might not just be good quality care, but maybe timeliness, access, experience, those kinds of things. So those are kind of the big mismatches. So how do we move forward? I'm going to kind of take each one. The first one gets at the demand side of healthcare, and the last two get at the supply side. So on how healthcare is designed, this is kind of that shift from endless repair to what we've heard about a lot, prevention, but like really, really doing it, such that whoever is the orchestrator of all the money we put into our social contract is accountable for actually not allowing the population to get sick. That seems like it's impossible, but there are other countries that are already doing this. Probably Singapore is the top of the food chain. There's aspects of this in China, in many of the Nordics. I worked in Netherlands for a year. We developed a publicly funded insurance scheme for wellness, right, to keep the population healthy, because the numbers were really clear. There's no way we could keep meeting all the demand with more supply of sick care. So that's the first one, accountability for upstream health. Back to how healthcare is delivered, moving from this kind of major friction that both patients experience at every touch point in the system, as well as clinicians, to kind of this state of flow. And so again, back to that once in a century tool we now have of AI, where jurisdictions around the world are moving is what we're calling an AI native operating system for healthcare, okay? That's at the system level, that you have an AI native system and it just takes the muck out. We estimate about 30% to 40% of what we spend on healthcare, and in Canada, that's $360 billion. That's 11% of our GDP. 30 to 40% is wasteful, duplicative, not necessary, or even harmful, right? All that sludge kind of comes out. But it also is an AI native operating system for each of you at the individual level. We've heard people already talking about how they're, have a personal health agent as their kind of co-pilot navigating through the health system. That will just be normal. Okay, and then back to the third one on how healthcare is paid for. This is probably the most controversial. I literally wore pearls because then we start clutching them. And when we suggest that we need to kind of catch up with the rest of the world and kind of eliminate this monopoly that there's only one way you can access care without any choice or any alternatives. So give people the right to be able to access care outside of the publicly funded system if it makes sense for them. And that might mean because they're paying privately, it might be through their employer or through other means. The gig is up and it's long overdue for Canada. All right, so what do you do about it? Anyone know what this reference is of J-Lo? She's like a triple threat. I look at who's in this room, and you're a triple threat. You can have one, two, or all three roles that are ways you can start to create some of these futures we've been discussing. The first is as a user, maybe a consumer of healthcare, or we might call you a patient or a patient partner. You know, I think your job to be done is two things. One is just demand more. Demand a better experience, a better outcome, better transparency, better access. You are financing the healthcare system. And second, there's a movement afoot called people-operated healthcare or patient-operated healthcare. You will have all the tools, all the information, and all the solutions at your hands at a pretty acceptable cost. I imagine we're going to have 44 million healthcare CEOs in Canada. Whether the healthcare system organizes itself or not to meet us there, we can kind of take healthcare into our own hands. The second is as a citizen, as the funder of our health system, advocate for this alternative access, this alternative payment model, and modernizing the Canada Health Act so that we're still keeping the values of universal and access, but not being obsessed about the infrastructure to get there. And then finally, in Canada, we have about 28 million people who work. So as an employer of those working people, this is a major lever that we have to kind of put into effect some of the ideas. To date, as employers, you've kind of funded health benefits, which was largely adjudicating claims for like drugs and massages. This major shift of employers as the lever point for upstream health, upstream prevention. Healthy workers do amazing work, and it's going to be a great access point. So in like another 20 years, when we do another CBC poll of the best Canadian, I really hope we're not going to put all of our eggs in one human who did all the radical work like Tommy Douglas did to create this major social movement for change. I hope it'll be a little bit of the theme of what we're hearing, that we kind of rose up and the 44 million Canadian healthcare CEOs decided it was time to modernize the Canada Health Act and kind of get it to the 21st century. Now, this might sound impossible. You might have heard my walk-up music was the message by Grandmaster Flash. And so just imagine back in the 80s, he was kind of the first on the scene with this very different type of music, hip-hop music. In pockets of the Bronx, on street corners, the establishment music industry, top down, completely ignored this. But eventually the people voted. They loved this music. Hip hop was born, Run DMC and all the others came out. And now it's kind of on all the airwaves and part of everyday pop culture. That's the idea for how I think we can kind of galvanize to create this future. Thank you.